Now, back to Sunrise on News Radio 880 KCMX. Swaying through the symphony of destruction.
Good morning, everyone. 17 minutes after the hour. Welcome back to the Sunrise Show. Thrilled to have you on this morning, and a real treat. Welcoming onto the program Dr. Gerald Friedman, and he's the professor currently. He's the chair of the economic department at the University of Massachusetts Amherst. He also holds a PhD of economics from Harvard University, and he's been championing single-payer healthcare system for years. And quite frankly, his figures, actually, his presentations make sense. He takes figures from around the world. And, of course, Gerald, we want to welcome you onto the program. Good morning, sir. How are you? From Massachusetts, and the snow out there has been pretty intense.
It's been glorious. I like to ski. Plus, I don't mind when I get a snow day from work.
Very good. Very good.
So it's all been good.
Exactly. I also want to welcome into the studio local advocate. He's the chair for the Rogue Valley chapter, Healthcare for All Oregon, Mark Kellenbeck. Mark, good morning. How are you?
Hey, I'm doing great. Glad to be here.
Exactly. So, Dr. Friedman, let's get right to it. And I've used your words many times because I saw your presentation in Medford when you were here at the RCC. And the Affordable Care Act is a calculated failure because the politicians didn't do anything to control pharmaceuticals or the administration costs. And for anyone that's out there that's picking up on this, talk about some of the astronomical costs that sets America aside from everyone else in the world related to pharmaceuticals and administration costs.
Well, we pay 65% more for drugs than the average for other countries. If you take all the drugs used and you weight them, we're paying, that's a study by the McKinsey Institute 8 years ago. More recent work has found that at least on some drugs, some of the most commonly used prescriptions, Americans pay 2 to 3 times as much. So our prices have continued to rise while everybody else is controlling costs of prescription drugs by negotiating with the drug companies. If you're taking drugs for blood pressure or some cancer drugs, you're paying 3-4 times as much as what people pay in the Netherlands or in Canada. There's a reason why up here in New England, where we're reasonably close to the Canadian border, people do go across the border and get a prescription from a Canadian doctor and buy the drugs there because it covers the transportation costs and by a couple months, maybe buy for a bunch of people. It's illegal, of course.
Wow.
I would recommend it.
Well,
but it does save you money.
Exactly.
I had this experience because when we were in Florence last year on my sabbatical, Florence, Italy, my younger daughter got sick, and we went to the hospital, which of course was free, and they gave us 2 prescriptions, one for a common antibiotic and one for some pain meds. And when I took them to the pharmacy, they came to a total of $15 U.S. for the 2 drugs. When I got back to the United States, I went to CVS, asked them, they would have been $60.
Yeah,
by the way, the Veterans Administration negotiates drug prices, and they buy at the world price. They buy at 41% cheaper than the rest of us.
Now, see, this is amazing, and I talked about this before. It's obviously been politicized because then you immediately go back to the ACA and the Obama administration or before that, and you don't want to get into the political weeds, but you go, why didn't the governing body tackle these issues?
Oh, it's all about politics.
Okay.
And that's all it is. I mean, on the second day in office, the Obama administration worked out an arrangement with the hospitals and with the drug companies that they would go ahead and go for universal coverage, but in a way that would not attack these 2 very powerful vested interests. Instead of fighting the Affordable Care Act, the Hospital Association of America actually spent $100 million in advertising supporting it. And you have to keep in mind, this law passed by one vote in both the House and the Senate. So against the opposition of the drug companies and the hospitals, it wouldn't have happened. These are just such, what we really have is not a medical problem, not a health policy problem. Everybody knows the right thing to do for the health of America and to save money. What we have is a political problem, the enormous power of vested interests in the insurance industry, the drug companies, and the hospitals.
You know what? You wonder, Dr. Friedman, you wonder if that sets us back. If unless this makes it has to blow up first before everybody will understand and maybe look toward this single-payer system. You wonder if that's possibly what's going on.
Well, I think one thing that will happen is as costs continue to rise, and the Affordable Care Act, I support the law, but it doesn't, as you said at the beginning, it doesn't control costs, and because it doesn't control costs, costs will continue to rise faster than income. And as that happens, we're going to be squeezing everything else out of our budget. We already spend overall, not just on drugs, overall Americans spend twice as much per person on health care as do people in other countries, other affluent countries, and we have a shorter life expectancy, and we get sick more than do people in other countries. Our healthcare system's failing. Health-wise, it's failing financially. The situation's going to get worse despite what's in the Affordable Care Act. Costs will continue to rise, and that will squeeze. We won't be able to go skiing. We won't be able to afford boats. We won't be able to afford movie theaters and all that. And then, we'll do something.
It's amazing. Ladies and gentlemen, we've got Dr. Gerald Friedman on with us. He's the current professor of economics there at University of Mass, Amherst. He's along with the chair of the department, and he's been on this fascinating advocate for single-payer healthcare system, and calling a spade is what it is. Dr. Friedman, we've got a quick break, and we'll be right back. Mark Kellenbeck is in the studio with us, and we've got a rally coming up in Salem next Wednesday on the 11th. We'll talk about that right after this. The Bloomberg Market Update is next on The Sunrise Show.
So get up. Top of the morning to ya.
Now, back to Sunrise on News Radio 880 KCMX.
Good morning, everyone. 35 minutes after the hour. Welcome back onto the Sunrise Show. And I'll tell you what, real treat, because we've got Dr. Gerald Friedman on with us. He's a professor of economics from the University of Massachusetts Amherst. He's the chair of the economic department, also has a PhD from Harvard University. And then in the studio with me, I've got Mark Kellenbeck, and he's the Rogue Valley chapter chair for Healthcare for All of Oregon. There's a rally coming up this next Wednesday, in Salem, Oregon, the 11th, right, Mark?
That's right.
So a rally, Healthcare for All of Oregon, and what do you think the disconnect there is between health insurance for all Oregon and corporate, and what's happening? What's the message that Healthcare for All of Oregon wants to send out?
First of all, the movement, it's a grassroots movement, so it's a statewide movement with local chapters. So I'm representing the Rogue Valley chapter, which is one of the stronger chapters and more active for sure. It's really such a cross-section of Oregonians, so it's represented by business and nonprofits and labor and nurses associations and doctors, et cetera, et cetera. So it's a very diverse cross-section of Oregon, really wanting to focus on the crisis, what really amounts to a crisis when it comes to healthcare delivery, healthcare finance.
And this would be business owners, right? You're talking business owners, grassroots?
Yeah, lots of support from business, particularly small business, which certainly is the case here in Southern Oregon, the Rogue Valley. So Main Street Alliance, which you're familiar with,
Right.
I'm quite active as one of the coalition members and
So
quite active.
whose attention are we going to get in Salem? Senate, House? Is there a favorite up there, and one of the legislators that you're going to focus on?
Yeah, so this is a movement that began in 2010, and we brought our first bill to the legislature in 2011. That was the Health Care All Oregon Act, and that bill was championed by sponsors, co-sponsors. One of those, not surprisingly, was Peter Buckley, our representative.
Mm-hmm.
And most recently, Dr. Bates, Senator Bates, has come on board. He's the chief sponsor in the Senate of the Healthcare Study Bill, Oregon's Healthcare Study Bill, which is our must-pass bill this session.
Yeah. Well, I brought that up because we were talking over the break with Dr. Friedman about Vermont and the fact that they were kind of on the cutting edge, and all of a sudden they pulled out of the single-payer health care. And Dr. Friedman, you commented on this article that came out in December. Vermont Governor Peter Shumlin stunned the healthcare policy world last week when he announced the state was scrapping plans to create a single-payer system. The state said the economics didn't work, but not everyone is convinced. And you said this is all politics, and so people and businesses are going to pay out the nose, aren't they?
Yes, because they'll continue with a system that is more expensive than what the governor's single-payer plan would have cost. The governor's own report documents close to $1 billion in savings. About 16% of healthcare spending in Vermont would have been saved by reduced administrative costs and greater efficiency from the single-payer plan.
Yeah, they were talking
but it was a political problem.
Well, yeah, and they're talking about 11.5% payroll tax. That would generate, amongst Vermonters, I guess, $2.6 billion needed.
$2.6 billion needed would have come from the payroll tax and from a sliding scale progressive income tax.
Right.
The payroll tax would have been about $1.5 billion. The rest would have come from the sliding scale income tax. But keep in mind, most businesses in Vermont are paying more than that for health insurance now. Health insurance for their workers now. And 93% of Vermonters would have been paying less for health insurance under the governor's plan than what they're paying now.
See, what's interesting, and I brought that correlation between Oregon and Vermont, is it's all political.
Yes.
So the stage has to be set, so you wonder, okay, in Oregon, how are we going to do that? Dr. Friedman, we've got a quick little break, and then we'll come back. This is just fascinating. We could talk for hours. And Dr. Friedman, it was such a joy to have you in town. Was it last year?
Last summer.
Spring.
Yeah, and the numbers are staggering, and it shows. These aren't political numbers by any means. These are real numbers that the U.S. is almost twice a cost for health care in the world, and $200 billion yearly. And the administration, I love what you called it, the administration bloat. We'll be right back on the Sunrise Show. We'll be back with Dr. Friedman and Mark Kellenbeck after the break.
This is Sunrise on News Radio 880 KCMX.
Good morning, everybody. Welcome back to the Sunrise Show. 48 minutes after the hour, continuing with Dr. Friedman and Mark Kellenbeck in the studio. And it's just fascinating because of the cost of health care, the Affordable Care Act, and what it is doing and how Americans can get ahead of this. I was talking to Dr. Friedman on the break and with Mark here. And, one of the things, number one, the 70-10 rule, the cherry picking and the lemon dropping, we know that's been going on. But when you get right down into businesses, and this is where the bigger picture comes out, is America is less competitive with business and with corporations and with jobs than the rest of the world. I mean, we're talking about jobs, and we're not even competitive because our healthcare costs are taking us out of the mix, right, Dr. Friedman?
That's exactly right. if you're paying an extra, as for a U.S. auto company, it's extra $500-700 per car for health care, than your competitors in Japan or Germany, then that makes it more expensive for you to sell your cars in the United States, and you lose your business. Makes it more expensive to export cars from the United States to China and other countries. And it encourages you, as GM and others have been doing, to move to Mexico and elsewhere to avoid health care costs.
So the large companies, if they have the ability, they're going to boogie and go somewhere else to escape the health care issue.
Exactly. It's adding significantly to your payroll costs.
So it's interesting because in Oregon, the figures are astronomical when it comes to small business. It's up around 90-95% of all business in Oregon is driven by small business. So they're just getting crushed by this healthcare cost. Mark?
Well, absolutely the case. So that's how I came to this issue. We saw our health premium cost, insurance costs, more than double in 7 years. So it's at like a 9.5% compounded rate. Now, I'll have to say the ACA has helped us drastically there, at least in the short term. So we've seen premium increases drop to 1% and 2%. So that's a huge blessing. But
Right.
the cost is continuing to escalate. We still haven't caught up with, the last 10 years of escalating costs. And bottom line, for small business, it comes right out of your profitability. It comes right out of your employee wages. And this has been compounded for really 2 decades. So in our case, our company, 25 years ago, we paid for our employees, their dependents, major medical, dental, vision, and an accidental life policy for 8.5% of payroll. That policy today would cost 32.5% of payroll. There are no economics that support that. We'd love to do it. This last 2 decades of struggling with this have been horrific. To us, it's come down to a real moral issues. So if you care about your employees and their families, you want them to be healthy, you want your workforce to be at their best, this is central to everything you do.
And sometimes I don't even know how small businesses make it. And I think one of the comments, that people in America are just going without health care. The Gallup poll said 33% of Americans are holding back and not making any type of medical coverage decision. So, Dr. Friedman, the 70-10 rule, describe very quickly this cherry picking and lemon dropping. And people know it, but 10%, the insurance companies are weeding out the 10% because they cost the 70%. Is that right?
Well, what it is about 10% of the people who have any particular health insurance plan, and this includes Medicare, it holds there too. 10% of the people account for 70% of the expense. And you think about, of course, most people, a third of the people on Medicare did not file a claim last year. They never went to the doctor. They were healthy. They were fine. Those people are cheap, obviously. Most other people don't use doctors very often because they're relatively healthy. And then you get hit by a car, or you get cancer, or something really bad happens, and your expenses explode. That's why we have insurance, for those catastrophic events. But that means for the insurance company that if they can identify the people who are going to be expensive and get them to go away, you can enormously reduce your costs and increase your profit.
And see, that's the profit model that doesn't work because of the insurance companies are always wanting to make more money. They don't care about anything else. They just want to make more money.
Well, making more money works for computers, works for shoes, because you make more money by selling more computers and selling more shoes. But for health insurance, you make more money by selling less.
Exactly, and that's why the 70-10 rule and the cherry picking and the lemon dropping. Unbelievable. Right. Dr. Friedman, are you scheduled to come back to the Valley anytime soon?
Not anytime soon, but I hope to be back soon enough.
Well, it would be great because I followed along, and it's great to hear your lectures. We posted one of your lectures up on our Facebook page.
Oh, wonderful.
Yeah,
thank you.
Yeah, so that would be good. And the Sunrise on KCMX Facebook page there. And then, Mark, the rally coming up this next Wednesday, Healthcare for All Oregon, very big deal. Anyone can go, right?
Yeah, we're taking a bus from the Valley. We've chartered a bus. To find out more about that, go to the Peace House website. You can actually sign up there. It's $35 up and back. It'll be a great rally, great speakers, great music. We'll be lobbying our legislators on the Hill. That's going to be real exciting. We're taking people up there who've never been before and are looking for a chance to tell their stories.
So take the day off. When is it? Wednesday the 11th. What time in the morning?
So the rally itself is from 11 a.m. to 1 p.m.
Okay.
The buses will leave here at 6 a.m. It's a long trip, of course. So it's a real exciting time, and we are getting great response. We're, of course, meeting with legislators now.
Is there a phone number or a website they can go for the bus ride or get plugged in there? Or
Yeah, there's a website, which is the Rogue Valley Healthcare All Oregon site. That's hcao-rv.org.
Okay.
That's a great site. There's also the statewide site. You can register for the rally, find out more about transportation, etc. And that's at hcao.org. Excellent site.
Well, let's post that on our Facebook page as well. Dr. Friedman, we got to go, but thank you so much. It's been just wonderful. We could run for days, but
Well, thank you very much for having me.
All right.
And I look forward to another time.
All right.